The Royal Aberdeen Children's Hospital. Where every year...
Option number one is chop it off.
more than 20,000 boys and girls from across the north of Scotland receive life-changing treatment.
Can you hear Mummy's voice, Clara? Oh, wow!
From a dedicated medical team.
It's different from Hobie City and Casualty and what you actually see in the soaps.
Coming up, Jason suffers serious injuries after crashing his quad bike.
If we were to touch him without adequate pain relief, he would be in a lot of pain.
A dangerous condition leaves baby Helena struggling to breathe.
Listen how noisy, because she's so desperate for us.
And we get the tips of the trade from the hospital painters.
Thank you, Jim. That's why it's a two-man job.
This is the Children's Hospital. The emergency department at the Royal Aberdeen Children's Hospital operates 24 hours a day and treats around 17,000 patients each year. Those with the most serious injuries receive urgent care in the department's resuscitation room.
When a child comes into resus, our first priority is to do what we something call a primary survey. Because in a primary survey, we're trying to identify things that actually can be life or limb-threatening.
14-year-old Jason and his mum have just arrived.
Do you feel the part of the body that you've broken?
Yeah, it's definitely.
It looks like it's your thigh bone. Yeah.
Which one's that? That one?
Yeah, that bone there. It's a big bone.
The thigh bone, or femur, is the largest bone in the body, and a suspected fracture is causing Jason severe pain. He was thrown off his quad bike after crashing into a barbed wire fence and landing in a field.
He wasn't crying or outwardly showing any emotion when I did find him, because he just said, "I've broken my leg." And there was no drama with Jason at all.
Okay, I just keep up twitching.
Yeah, it's all the muscle spasm.
Emergency medicine consultant Dr. Lee is coordinating Jason's care.
A fractured femur is actually a very painful injury. If we were to touch him without adequate pain relief, he would be in a lot of pain. So the plan is, I'm going to give him just a small dose of ketamine just to allow the pain. Might be a small risk that you might have some hallucinations when you later on. But don't worry about it, yeah? Yeah, you feel that now, eh?
I feel good.
Comfy?
A portable X-ray is brought in to assess Jason's injuries. Orthopaedic registrar Mr. Whitaker checks the results.
So he's got a mid-shaft distal femur fracture. You can see it's quite overlapped. So the plan now is first aid first. So we'll put him some traction for pain.
Applying a traction splint will help stabilise the fracture, but it's a potentially excruciating procedure. Jason will need stronger pain relief.
Hands with you, Daddy, got them for me. Good lad. Feasting.
Emergency medicine registrar Ben and nurse Lauren perform a nerve block.
Just feel pushing though, not relax.
An ultrasound scan helps guide them to the correct nerve, where a local anaesthetic is injected.
For perpendicular, just go straight down.
This will remove all feeling in Jason's leg.
Okay, and inject by 2 mils.
There should be no resistance, yeah?
No, there isn't.
Good. Jason, are you feeling anything? Any improvement?
My leg doesn't feel as bad, but it's still
Yeah.
While the team waits for the nerve block to take hold, Mr. Whitaker prepares the splint.
This is a splint that was invented
in World War I, they found that army patients who had open femur fractures, the mortality rate was about 80% in the field. When they introduced the Thomas splint, which is a simple mechanism of holding the bones still and reduces the amount of volume in the thigh, so it reduces bleeding, the mortality rate drops by half. So revolutionised just field trauma, and we're still using it.
You're going to breathe with me. Deep breaths in and out. Nice and slow. That's it. And relax. And that's it. Be all right. Deep breaths now. Okay, and relax your leg. That's it. Good man. That's it.
1, 2.
Oh well, the block's definitely working if you can lift it that high. So.
Yeah.
Jason, wiggle your toes for me.
The splint is a temporary fix. Jason's stay in hospital is far from over.
There are options in children to do non-operative management, which would involve using the traction system for at least 6 to 8 weeks. But Jason's a big boy and he's fit and active, and I don't think he'd take too kindly to sitting in bed for 8 weeks.
Jason will have surgery tomorrow.
I love you in the morning and in the afternoon.